Welcome back. The heart is one of the biggest, most important muscles in your body, and taking care of it should definitely be a priority. Modern Heart and Vascular Institute wants to inspire people to get early screenings for heart disease, which could help prevent future heart attacks and strokes.
Your heart is one of the biggest and most important muscles in your body, and taking care of it should be a priority. And we're here today at the Modern Heart and Vascular Institute with cardiologist Dr. Rajiv Agarwal. Thank you so much for having us today.
Thank you for coming.
I'm fascinated in learning about all of your spectacular new cardiovascular technology.
Wonderful.
Tell us a little bit about the machine that we're standing in front of.
Well, this is a 128 slice CT scanner. And what this does, Lauren, is it's able to diagnose premature heart disease at a very, very, very early stage. So we are able to find even minor blockages in people that are at risk of heart attacks and heart disease in the future at an early stage and prevent them from getting heart attacks and needing procedures and surgeries and a whole bunch of medications.
So if heart disease runs in your family, or you're prone to even getting it down the line, this is a wonderful machine to very early on help you diagnose that.
Absolutely, absolutely. And the scan itself takes only 1 to 2 seconds.
Oh, it's so fast.
So patient lies down, they go in the scanner, and they come out. And what we see on there is we can see calcium buildup in the arteries, which tells us that they have premature heart disease. And if they have that, then we have options to help them at an early stage.
Now, doctor, which risk factors are the greatest concern that lead to the most blockages?
Yeah, so they're the traditional risk factors like diabetes, high blood pressure, high cholesterol, smoking, lack of exercise, stress, but the most important one is family history. So if you have a first or second degree relative like parent, brother, sister, cousin, aunt, uncle who has had a stroke, heart attacks, has had bypass surgery, stents, any blockages in the legs, neck, heart, you are at the highest risk. Definitely.
Now, if it doesn't already pre-run in your family, what are some other things that people should look out for?
So what they need to look out for, number one, is symptoms. If they're having any cardiovascular symptoms, such as any chest discomfort, shortness of breath, dizziness, lightheaded, pain in legs, palpitations like your heart is racing, those are common heart symptoms that can tell you maybe there's something going on. Like you see in athletes, young men and women, professional athletes, they're playing sports and all of a sudden they collapse and die. Well, it turns out most of them did have some symptoms or have something abnormal on an EKG or some risk factor that should have been picked up earlier and made it to go away.
An underlying symptom, which is what this machine is going to help us take care of.
Yes, yes.
So this is, we've heard of the 64 slice CT scanner, but you guys here at Modern Heart and Vascular has this 128 slice CT scanner. I sound so professional saying it. So what are slices?
So slices are how many pictures of the heart you're taking with one rotation of the machinery inside. So 64 slices means that I'm going to cover about 6.4 centimeters or a little bit less with one rotation. The heart's about this big. And if you can image the whole heart with one rotation, which typically is even less than 1 second, so the higher number of slices does mean more coverage, a faster scan. Patients are just, it's more convenient for them because some people have back issues. They can't lie down for long, Lauren, so they go in the scanner and before they know it, they're already coming out and the scan is completed.
We're talking 128 versus 64, that's doubling.
Correct, and that also means if it's a faster scan, it also means a little bit less radiation for our patients. So we feel comfortable doing these on the younger patients who have the most benefit by finding premature heart disease, but don't have to worry about the risk of getting a lot of radiation and then risk of cancers or problems in the future.
So say you know somebody with some premature symptoms, what's the first step that they should take?
Well, first step they should take is they should seek help, either with their primary care physician or with a cardiologist, and explain the symptoms to them. And if it sounds like something that's cardiovascular, then certainly something like this or other cardiac imaging such as a ultrasound, stress test, there are appropriate guidelines on who should get what based on their age, their risk factor profile, their symptoms. And so we can guide them getting what's the best option for them.
Doctor, I'm sure you hear this all the time, but Is heart disease just as common in men as it is women?
Absolutely, absolutely. I mean, we're very supportive of breast health for women, but women forget that heart disease is actually 30 times more likely to happen than breast cancer. Heart disease is by far the most common cause of death in both men and women. So we're supportive of all the other organizations, but we have to pay attention to the #1 cause of death in our country in men and women both. So women, yes, they have to get screened at earlier ages.
Absolutely. Well, doctor, thank you so much for all the information. It really is wonderful. I love the advances in this cardiovascular technology world, and we're just so happy that you're here to tell us about them.
Thank you very much,
Thank you so much. Well, for more information and info on their multiple locations around the greater Houston area, all you have to do is log on to modernheartandvascular.com.
Lauren, thank you. And for the first 100 callers, Modern Heart and Vascular Institute is offering a free cardiovascular screenings package. It includes a complimentary electrocardiogram, stroke screening, and blood pressure evaluation.